Asuncion, the farthest south the staff travels. It is 2 days upriver on the Kiki Bay and deeper into the mountainous jungles, where the Beni begins to branch into its many tributaries, and the water becomes shallow and hard to navigate. It is not the last village. There are still more farther upriver that do not have access to health care. Some people will hike in for the project's scheduled visits. Others too sick to make the journey will not. Many more communities beyond where the project reaches have asked for assistance. But the project does not yet have the resources to expand and has to concentrate on the areas it covers now. There is a quality of life to be admired here. My father saw it, and that is why he stayed. There is a simplicity in the daily rhythms, but also a confidence. They make most things from what the jungle can provide, and live quite well off their harvest and catch. Everyone here, my father wrote, even Antonio and the people working with me, have one foot still in the jungle, and in a moment's notice could step back into that primitive life, that night of first ages, which for me leaves something to be admired amongst the friends that I have made here. That night dinner was duck, freshly husked rice, fried banana, and fresh mango juice. It's when the people give back to the staff, and it's much appreciated after a long day.
In 1999, when I first did my first trip here, it was in November of '99, and Lou and I had already talked, Dr. Netzer and I had already talked very, very much about the real importance of health education and health prevention in the communities. But we became very, very aware that health education and preventative medicine is really the core of any public health project.
Sí, él también tiene todos los niños, no vamos a hablar otras cosas que no sean para ellos.
With this in mind, we went out and hired Dr. Frida Guzman, who has become the coordinator of the health prevention program. Essentially what Dr. Frida does is, while the adults are waiting to be seen, she'll take them aside in the room or outside, and she'll begin giving short health talks.
Para los niños damos clases de formación no solamente en educación en salud, damos sobre nutrición, damos sobre enfermedades de transmisión sexual.
¿Qué hombre te habrás metido? Lamentablemente, si uno no está con su esposo, el esposo nos riñe. Hacen lo que nosotros hemos pasado. Tenemos que tener ese lapso de 2 a 3 años para recuperar y volver a tener otro niño sano.
Then with the children of the community, what Frida will do is, while the consults are taking place, she'll go outside and begin giving short skits or talks to the children of the community, and looking at really basic sanitation and hygiene health issues. The washing of hands is something that is very, very important. Things that we take for granted, basic hygiene and sanitation issues.
Estos va a estar diseminado por todo esto, por eso no es bueno andar sin zapatos. Siempre. Entonces, nosotros cuando entramos al baño,
the children love to have these skits by Frida, and she'll begin discussing the basic anatomy of the body, and this has been seen as really important because the children know that when we arrive, Dr. Frida is going to be there, and she'll begin some of her skits, and it turns into be sometimes humorous, and it's just a great way to bring the community together. One thing that we started doing back in '99 is working with the communities and starting to identify in these communities individuals, young males, young females, who were selected by the community to become health promoters. Those are essentially community health workers. We provide the courses for them. Once every 2 months they will come from their villages to Rarnabaki, and we have a whole curriculum that we use, which is a 4-year curriculum. And these health promoters are going to be the key to our work. During this first year of training, we have 14 health promoters who are being trained from 11 communities. And they are beginning to take a real important part of the health issues in their communities. We have a health promoter now who's done a year and a half of training with us, and her name is Yasira.
Mi nombre es Yasira Cartagena Terraza y vivo en la comunidad de San. Yo pienso del proyecto que es un excelente proyecto que ha venido aquí a Bolivia porque ningún otro proyecto se ha preocupado por nosotros, la gente que más necesitamos. Mis responsabilidades como promotora es promover la salud de las personas y ver hacia alrededor, ¿no? Ver cómo puedo ayudar a la gente, cómo sacar a los más enfermos, ¿no?
But the future of the Rio Beni Health Project is the promoters. It's promoters that are being trained. It's promoters that have the heartfelt desire to learn about basic issues of health and be able to go back to their communities. They live in their communities. They are the ones that are going to carry the project in the future.